This is Jimmy. Jimmy is a childhood friend and actually now is a young adult who loves to sing and play the cello and even use a baton. Jimmy also is a young adult with autism spectrum disorder. Music helps him come alive as he connects with the melodies and expresses his passion through the lyrics. Watching music give voice to a boy who doesn't present with a voice was a beautiful experience that connected my heart with the ASD population in a very personal and real way. One of the big overarching reasons that I chose to study children with autism spectrum disorder was to gain a deeper knowledge of the diverse spectrum and the varied methods of music therapy used to help this population. More specifically, I want to understand ASD's growing prevalence in today's society and to explore its interventional focus on discovery versus recovery. According to the Mayo Clinic, autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. The Center for Disease Control and Prevention predicted a 15% increase of ASD nationally, with 1 in 59 children being diagnosed. The CDC also states that that autism is 4 times more likely to be diagnosed in boys than in girls. In Donovan and Zucker's article on autism in early America, they explain that the rise of ASD may be due to 2 reasons. The first being that researchers have continually revised the operative definition of autism, generally in a direction that makes it easier to qualify for the label now than it has been in the past. And the second reason may be that we are getting better at finding those people who merit the diagnosis that may have once been overlooked. ASD is a diagnosis based on observed behaviors which are extremely varied depending on the child. Some of the symptoms of ASD include poor eye contact, lack of facial expressions. They may have difficulty recognizing feelings and nonverbal social cues in others. They present some mostly repetitive types of behavior. And a person with ASD may also may not be able to speak, or their speech is delayed, and they show fascination with parts of objects, such as like the wheels of a small toy car. The Mayo Clinic lists genetic disorders as the main known cause of ASD, and they explain that researchers are still exploring whether or not environmental factors play a part in causing ASD. Unfortunately, no prevention has been found and no cure exists, but treatments are used to actualize a child's potential and develop his or her quality of life. Osborne, in her Autism Treatment Guide, lists some of the medicines used to help manage some of the effects of autism. Antipsychotics help with aggression, self-harm, and behavioral problems. Antidepressants are useful for treating obsessive-compulsive disorders, depression, and anxiety in people with autism. Stimulants treat symptoms such as inattention and hyperactivity, and then anticonvulsants are used for children with ASD who have epilepsy. Osborne also affirms that therapy treatments are used to help address the varying effects of autism. Some examples of these therapies, therapy treatments are, first of all, speech and language therapy, which helps with communication. The second one is cognitive behavioral therapy, which helps children with ASD recognize connections between feelings, like their thoughts and behaviors. Applied behavioral analysis is the third treatment, in which a reward system is used to encourage positive behaviors. And then lastly is music therapy, which provides musical experiences through which a child with autism can build a relationship, increase their motor functioning, and their use of senses. I would like to talk a bit about music therapy and ASD and how it has effectively proven to demonstrate techniques for specific aspects of the ASD diagnosis. A team of clinically trained music therapists undertook an analysis of previously found research to assess the effects of music therapy versus the effects of standard therapy for individuals with ASD. This is the conclusion that they came to. Music therapy has been shown to be superior to standard care and to similar forms of therapy where music was not used, which may be indicative of a specificity of the effect of music within music therapy. In addition, the results of this review suggest that therapy approaches that focus on the relational qualities of music within interactions and on the client's own interests and motivations may be effective in increasing basic skills of social communication, such as keeping eye contact or initiating interaction. The goals of communication and social interaction can be accomplished through the music therapy technique of shared music making. According to Kern and Humpel, the editors of an article that discusses developing potential in young children with autism spectrum disorder and their families, they advocate that social reciprocity, mirroring, emotional attunement, and shared attention are all aspects of communicative interaction found within clinical improvisation. Social interaction training uses musical experiences that incorporate turn-taking and joint attention skills, along with reading body language and expressions. Another method used in music therapy for people with ASD is neurological music therapy, which includes auditory perception training and developmental speech and language training. Auditory perception training increases the child's ability to adapt to sound within their environment and decreases his or her sensitivity to environmental stimuli. Patrick is a 9-year-old boy who struggles with sensory processing disorder. Unfamiliar noises such as cars driving by or people talking in a room with him, but he can't see them, causes him to cover his ears and go into fits of screaming. So a music therapist worked with Patrick to bring him to a place where he could function in some of the most audibly stimulating situations he couldn't handle before. His process began with familiar and predictable music, and then he transitioned into actually controlling the musical experience at different dynamic levels. So if Patrick was controlling the dynamic, he could have it be very loud, and he was okay as long as he was controlling the dynamic. The music therapist then actually removed his vision by blindfolding him and having him learn to actually narrow down the stimuli which he chose to focus on in his listening without being able to see everything around him. And then this eventually led to being reintroduced to more stimulating everyday situations actually without the music therapist. Carpent and Lagasse conclude in this story of Patrick that this process decreased Patrick's dependence on ear covering. It allowed him to walk through noisy environments without behavioral outbursts and helped him to maintain focus on a selected stimulus. One of the other venues in which music therapy is used for children with ASD is in targeting the speech needs of the child through age-appropriate music with the goal of developmental speech and language training. Music is a powerful therapy and intervention for children with autism. Discovery plays an integral part in the music therapy process for kids with ASD in order to learn their holistic potential. Just as in my friend Jimmy's life, music gives not only voice to a child who struggles to express emotion, but also gives purpose and meaning to their emotions and behaviors. Music therapy gives clients with ASD the opportunity to discover the world around them and how they function in it, even as they navigate their own individual discovery.